Let's talk about pneumonia. By definition, pneumonia is an inflammation in the lungs parenchyma, and that involved every tissue inside within the lungs, alveoli ducts, and the bronchioles. So it is an inflammation. Okay, the etiologies includes several different things. So we have could be a viral infection, could be a bacterial infection, could be aspiration, or also could be a fungal infection. So all of these microorganisms and these incidents can cause pneumonia. The pathophysiology of pneumonia. So there is invasion of microorganism, could be bacteria, could be fungal, could be viruses. As long as we have this normal defense mechanism that include coughing, sneezing, and also the cilias that will catch this microorganism, patient will continue to be healthy. Now, if they manage to go to the alveoli, they will be detected by the white blood cells, mainly neutrophils, and there will be an immune reaction to it, which will result in pus, and this pus will inflame and fill the alveoli and make them more consolidated, and that of course will affect the gas exchange. So simply that is the pathophysiology of pneumonia. So again, the patient who is at risk, a patient who lost their mechanism or defense mechanism, or a patient who became immunocompromised. There's always a continuous invasion of microorganisms. When the patient don't have mechanism to protect themselves from this invasion, or they have the immunity, these microorganisms will reach to the alveoli, neutrophils will react, result in immune reaction, result in pus and consolidation that fills the alveoli, and of course that will lead to decreased gas exchange and production of sputum, where the patient will be coughing it. So who's at risk? Now, as you understand, there are two groups of people who lost their defense mechanisms, or people with immunodeficiency. Patient lose these mechanisms of defense by age, also altered level of consciousness after drugs or anesthesia. Patient with NG feedings because of the tube. The NG tube works as a bypass, basically, or a way for this microorganism. In addition to aspiration, of course, also patient with COPDs, disease like COPDs, they also lose this mechanism. Patient with HIV or prolonged use of corticosteroids or medication that suppress the immunity, like the medication that are used after transplants. Also, a chronic use of antibiotics can decrease the immunity, and so this patient became at high risk for pneumonia.